Hello, hello, hello. Good morning. This is Abdul. So, hello, good morning. This is Abdul. So, I'm going through the guidelines for design and construction of healthcare facilities by the Facility Guidelines Institute. I'm going to go through the whole book. Then now I'm going to go through it page by page from the beginning up to the end. Of course, not in one day. I don't know how much time I'll take, but I'm thinking of doing like 1 hour per day of this book. Those of you on TikTok, I will post the video on YouTube. Yeah, I'm going to post it on YouTube. So you go on my YouTube, it's called Facility Design MEP. Oh yeah, I'm doing a screen recording also. So preface, let me skip this. Um, Acknowledgements. Tugenda wa, skipping acknowledgements. Media addition and reviews. I don't think that's necessary. So I'm still in the preliminaries. Then I'll reach the glossary. So I'll reach the general introduction. The provision of this chapter shall comply to your facility projects. Okay. The document covers healthcare facilities common to communities in the United States. Okay. Facilities within MEP services will require special consideration. However, sections herein may be applicable for parts of any facility and may be used where appropriate. So I'm about to statement. The guidelines for design and construction of healthcare facilities developed through the consensus. Let me describe this. Hello, I'm going through the FGI design of healthcare facilities. So here they are saying the guidelines for design and construction of healthcare facility guidelines is developed through a consensus process similar to one approved by the American National Standard Institute. This American National Standard Institute, these are the guys who bring us, I think, the NFPA, the info codes. Uh, I'm not sure about Ashley, but I think they're under these guys. The process brings together the members of the Health Guidelines Revision Committee of the Facility Guidelines Institute. The HGRC is a balanced group of volunteers representing varied viewpoints and interests in healthcare facility planning, design, and construction. It considers proposals for change received from the public, archives consensus on healthcare facility planning, design, and construction issues, and develops proposed revisions to the previous editions of these guidelines. The proposed revisions are then published for public comment and revision by HGRC as needed. In response to these comments, the product of this version of this revision process is then compiled and published as a new edition of the guidelines. The publisher of the 2010 edition is the American Society of Healthcare Engineering of the American Hospital Association. Healthcare Engineering. Okay. American Society for Healthcare Engineering. These hospitals are not easy things to construct, especially if you are going to consider digital hospitals. So there's a lot of things which go in place. So we really try our best to comply with the code. So there are many, and when you're looking at MEP services, you you find that there is so many. Leave alone, like if you consider like only communication, you find that in communication you have assistant calls, you have nurse calls, you have doc calls, you have patient calls, you have, then if you go to electrical, you go to ELV, you go to HVAC, you go to plumbing. There's a lot of things to be taken care of. Continue to the document, sorry for that. Users of this document, the guidelines are made available for a wide variety of public and private users. These include reference in laws. Okay, they include reference in laws, and these include reference in laws, codes, rules, and regulations, as well as using private self-regulation and standardization of space and equipment requirements and the promotion of safe practices and methods in planning, designing, and construction of various types of healthcare facilities. I think I've gotten in healthcare engineering. Okay, regulatory use of these guidelines or portion there or for regulation purposes should be accomplished through adoption by reference. The term adoption by reference means citing of title, edition, and publishing information only. Okay, I don't know what you mean by that. Okay, but let us continue. Any deletions, addition, and changes desired by adopting authority by the adopting authority should be noted separately the adopting instrument. Okay. What are they trying to mean here? I have no idea. What are you guys trying to mean? Okay, to help the facility design guidelines institute, to help FGI follow the usage made of this statement, adopting authority are requested to notify FGI as info at fgigairlines.org when they adopt these guidelines or use them in any other regulatory fashion. Then you go to the disclaimers. I don't think this here full. Okay. Interpretations, renovation, governance regulations, building codes and standards. Okay. The first building code and standards cited in the facility design guideline. Every healthcare facility shall provide and maintain a safe environment for patients, personnel, and the public. Code compliance. In absence of state or local requirements, the project shall comply with the provided nationally recognized building codes, except as modified in the latest edition of the NFPA 101 and stock or therein. References made in these guidelines to appropriately model codes and standards do not generally duplicate wording of the reference codes. The National Fire Protection Association (NFPA) standards are the basic standards for reference, but other codes or standards may be included as part of the guidelines. See section. Reference codes material resulting in the issue current at the time of this publication. The latest revision of code material is usually a clarification of printing or general improvement in the safety concepts and may be used as an entry document for earlier code revisions. Questions of publication should be addressed as the need occurs. The actual version of code adopted by the jurisdiction may be different. Confirm the version adopted in the particular location having with the authority having jurisdiction. Um, Equivalent performance standards. That is what we call for. I don't know how to do it. The minimum standards of these guidelines have been established to maintain a desired performance result. Access standards. Perspective limitations, whether it is a number of dimension or quantities, when given this type of condition that contains as practical. The standards. Okay, there's some noise outside. I don't know if you guys can hear it, but if you can hear me, please stop by. Okay, function of we are still continuing. I want to go to the MEP section. That is design. It's still a lot of Lugambo. I want to go to the MEP. Well, let me go to the table of contents directly. Facility design script. Introduction, reservation, okay, commissioning site, equipment. Let me go to FTP strategy. Page 47. Okay, we are here at the common elements for hospitals. Application. This chapter contains elements. We are at chapter 2, common elements for hospitals. This chapter contains elements that are common to most types of hospitals. The elements are required only when referenced in a specific hospital facility chapter. Additional specific requirements are located in the facility chapters of Part 2. Facility chapters are listed below. Consult the facility chapters to determine if elements in this hospital are required. In hospitals, what, okay. Functional program. For each project, there shall be a functional program for the facility requirements. Department size and clear flow area requirements shall depend on program requirements and organization of services within the hospital. Combination or sharing of some functions shall be permitted provided the layout having the call. Let me so size and layout. Let me also call it. Department size and clear flow area requirements shall depend on program requirements and organization of the services within the hospital. Combination or sharing of some functions. First, so size and layout. Department size and clear flow area requirements shall depend on program requirements and organization of the services within the hospital. Combination or sharing of some functions shall be permitted provided the layout does not compromise safety standards and medical and nursing practices. I don't, okay, medical and nursing practices, this we are not so much exposed as engineers, but we may be in a know of the safety standards, though not the medical ones. This wise, most times we work with our biomedical engineers when we are designing or constructing hospital. Because now when we are designing, the biomedical engineers give us this information of the medical and nursing best practices. Though the more you are into construction of hospitals, is the more you get familiar with these standards, and at some points you can advise. So then we go to parking. Parking provided shall comply with the general requirements, and for the specific requirements in each chapter of part of these guidelines. Okay, not so much information given here, but there's reference what we should to where we should get the information from. So nursing units and other patient care areas. Okay, general. The patient room or care area requirements included in this section are common to most hospitals. For requirements specific to a facility type, okay, they will refer you. In the patient room, so for specific requirements, see as facility chapter. For specific requirements for the patient room, we have the minor encroachments, including columns and washing stations that do not interfere with functions may be ignored when determining specific requirements for patient room. I'm not sure what they mean. Okay, we of course when you are constructing hospital or a civil building, they are columns. Some points they interfere, sometimes they don't, but usually the architects design spaces in order to, let me first take this poll. With our hospital design, so we are now at inpatient rooms. We are seeing the space requirements for the patient rooms. For most specialized hospitals, these patient rooms can be. We are continuing with our hospital design. So we are looking at space requirements in the patient room. For more specialized hospitals, some manufacturers, the okay, the service providers, people who are going to operate the hospital, sometimes they dictate the space requirements they need. So here they are saying space requirements, minor equipment, including columns, washing stations, do not interfere with the function, may be ignored when determining space requirements. Okay. For space requirements, switch of gas. Okay, windows. Here they also refer the windows. Okay, windows. For space requirements, see facility chapters. There's a lot of things about windows, mostly in patient rooms. Though also maybe for general wards, aeration is highly encouraged. Yeah, and windows have to be low since warm air has to move in and cold air has to move in and warm air has to get out. You find that if you put windows a bit up, you are not creating a window, it turns into a vent. Because warm air is up, so it's just warm air getting out. It's basically a vent. So for hospitals, we have to put windows a little bit lower than the normal windows so that a lot of radiation is coming in. And then you can put something up to vent, or you can just extract or return or something like that. Patient privacy in multiple bedrooms, visual privacy from casual observation by other patients and visitors shall be provided for each patient. The design for privacy shall not restrict patient access to the entrance and hand washing stations or toilets. This is basically in the general wards. We usually put, you see those big green curtains, which are on rails, which are on rails. Yeah, you guys, you are aware seeing those. Hand washing stations, for specific requirements, see facility chapter. But design requirements, for hand washing station, design details. See, for sinks, we also require you protocol requirements. Okay, toilet, where now we are in patient toilet room, where required by other sections of the guidelines, patients shall have access to a toilet room without having to enter corridor. Huh. Here in Uganda, we do comply with such. I'm not sure, but okay. I've never seen a hospital which complies to this. Like where required by the section of the guidelines, each patient shall have access to a toilet room without having to enter a corridor. Um, I've never seen this in any hospital. Maybe in VIP rooms, VIP patient rooms, VVIP rooms where we have self-contained rooms. But other than that, there's no way you can access. Maybe you can guide me, you people, you can guide me in the comment section. But I don't know of any of how you can access a toilet without first going to the corridor. Because we have rooms side by side. If you guys come, then we go to the corridor. Because you already have the building core or ducts. In Uganda, mostly use ducts. We don't usually use building cores. Usually have ducts at at, at the end of the building or specific corners or what, and you can access there through the corridor. Like yeah. Then Another thing, unless located in a toilet room, bed pad washing fixtures shall be installed in dedicated rooms, separate from patient care areas for requirements. I don't know what they mean by bedpan washing fixtures. Bedpan washing fixtures. Bedpan washing fixtures. Let me try to search for it here. Okay, I have to move this. Then bedpan. What are these bedpan washing? Yeah. Bedpan washing fixtures are specialized. So I've got something here. Bedpan washing fixtures are specialized plumbing and medical devices designed to hygienically dispose of human waste and sanitize reusable containers like bedpans, urinals, and clean dishes. Um, to hygienically dispose of human waste and sanitize reusable containers. Okay. Um, Let me post this on my LinkedIn. Oh, I've actually never. There are so many things we don't have in Uganda. Can I get an image of a bed pan unit? Let me add an image. What is this thing? The bed pan, the bed pan unit. Save, save image. Ah, that is not happening. Let me just search for it. Let me search for. It is there. Why am I not seeing it in it? Okay, that's Okay, you guys, you can follow me on my LinkedIn. So let me go back. Where was I? Okay, I've seen what a bed fan unit is. Uh-huh. Forgetting where I was. Let me first bring this in here. Time has caught me up. Stop here. Anyway, the toilet room shall serve no more than two patients and no more than four beds. Huh? Shall serve no more than two patients and no more than four beds. The toilet room shall contain a toilet and hand washing station. Requirements for specified to see the relevant aspect. Toilet room doors shall swing outward or be equipped with emergency rescue hardware. Wow. Okay, I have to stop here. I'm going to post this on my LinkedIn. I don't know if I should put it on TikTok, maybe on my WhatsApp, but this is interesting. I didn't know about this. Hospitals are they are strict, really strict. Not especially have a specialized one. Okay. See you.